joining us for today's segment of Live Healthy here at Trident Medical Center. I'm your host, Lauren Collar, and joining us today is Dr. James Benner of Palmetto Cardiovascular and Thoracic Associates. Thank you for joining us today.
Sure, my pleasure.
We're talking vascular health. What is vascular health?
I mean, vascular health is a very broad kind of spectrum assessment of your overall well-being. It deals with the arterial tree throughout your entire body.
What about vascular disease?
You know, vascular disease is just kind of an aging process that happens to the arteries as you get older. Some people it happens when you're 30 and 40, some people it happens when you're 80 and 90.
So it can happen at different ages?
It definitely can. Genetics plays a huge role in that, and lifestyle, some of the risk factors that people participate in. What
are some of the symptoms that bring patients to you?
Vascular, kind of the broad spectrum of vascular disease is certainly encompasses a lot of different things, from the heart attacks needing bypass surgery, to strokes needing endarterectomies, to vascular disease involving the legs, which we call PAD, PVD, which causes people to have discomfort in their legs when they're walking.
What about here in the Low Country? How is the generalized overall vascular health here in the Low Country?
It's probably moderate to high risk. You know, this is considered the stroke belt, and it is definitely prevalent. And some of it has to do with genetics. Some of it has to do with lifestyle, smoking, dietary choices of some people, but we do have a very high prevalence of stroke, very high prevalence of coronary artery disease, as well as peripheral vascular disease.
What happens when a patient does come in with some of the warning signs and red flags of vascular health issues?
You know, certainly it's the markers that we look at, claudication, TIAs, so something that tells us that there is a disease process ongoing within their body, and that we need to look a little bit closer into things. You know, one of the most common things that we look at is screening, peripheral vascular screening for the lower extremities, looking for people that have claudication, because it's a huge marker. It gives us kind of a window into the world that if they're having some progressive disease in their lower extremities, then it probably is elsewhere. So then you have to start looking and assessing them from a standpoint of their cardiac health, as well as their neurologic and stroke risk.
All right, thank you for joining us, Dr. Benner.
Thank you.
Thank you for being a part of this segment of Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.